Hello everyone, welcome back to this channel. In today's video, we'll be looking at the anatomy of the neck. Though the neck might be seen as a small region, it contains vital structures that connect the head to the rest of the body. By the end of this video, you will understand its boundaries, major muscles, major nerves, blood vessels, and its critical importance. What is the neck? The neck is the region between the head and the thorax. Here is your neck. This is the neck. It supports the head while providing passageways for the airway, digestive tract, major blood vessels, nerves, and your spinal cord. Because many important structures passes through the neck, it is one of the most clinically significant regions of the body. Let's look at the major muscles of the neck. The most prominent muscle is the sternocleidomastoid muscle. It extends from the sternum and clavicle to the myxoid process of the skull. When one side contracts, it rotates the head to the opposite direction. When both sides contract together, they flex the neck. Another important muscle is the trapezius, located at the back of the neck. It helps to extend the neck, stabilize the shoulder, and move the scapula. Suprahyoid muscle elevates the hyoid bone during swallowing, while infrahyoid muscle depresses the hyoid bone and the larynx after swallowing. These muscle groups are necessary for speaking and swallowing. The neck contains the common carotid arteries, which divide into internal and external carotid arteries, supplying the face and the scalp. Venous drainage is mainly through the internal jugular vein, which carries blood from the brain and face back to the heart. Neck is the vagus nerve, that is cranial nerve 10. It travels within the carotid sheath and supplies the structures in the neck, thorax, and abdomen. The accessory nerve, which is the cranial nerve 11, supplies the sternocleidomastoid muscles and the trapezius muscles. They also found in the neck. The cervical plexus provides sensation to the neck and contributes to the phrenic nerve, which controls the diaphragm and the breathing. Triangles of the neck. The sternocleidomastoid muscle divides the neck into two important triangles, the anterior and the posterior triangle. The anterior triangle contains the thyroid gland, larynx, pharynx, carotid arteries, and several cranial nerves, while the posterior triangle contains the accessory nerve, parts of the brachial plexus, and important blood vessels. These triangles help healthcare professionals locate anatomical structures during examination and surgery. Let's look at the clinical importance of the neck. Knowledge of the neck anatomy is essential for procedures such as central nervous catheterization, thyroid surgery, and evaluation of the neck swelling or enlarged lymph nodes. Injury to the neck can affect breathing, swallowing, blood supply to the brain, and nerve functions. To summarize, the neck connects the head with the body and contains vital muscles, nerves, blood vessels, and glands and organs. Understanding its anatomy is fundamental for students, healthcare professionals, and anyone studying anatomy. If you enjoyed this lesson, please like, subscribe, and share this video. Thanks you for watching, and I will see you in the next anatomy.